In this SmartDentist video, we're looking at using SmartDentist for incident reporting and explaining incident reporting so all staff members can come on board that concept, which is really important in dental practice accreditation. So this is the area you see when you log in to SmartDentist, and we're going to go to our resources area where all documents and helpful bits of SmartDentist are located, and look under safety and quality, and we can see we have reports, audits, risk management, and some of the registers needed in safety and quality. So we have the ability to add in incident reporting. So how does that work? Well, here is a list of helpful guides for all parts of safety and quality, and the top one is the Staff Guide to Incident Reporting and Risk Management. I opened this up before, and this is what it looks like. You might like to print it and stick it up in the staff room so people can consider this. Incident reporting is formalising a procedure that you already do all the time in your dental practice. We all know, especially in a small suburban dental practice, that safety and quality is part of everyone's job description. So imagine you find something at work that you consider might cause harm or hazard. What do you do? Well, the obvious thing that we know everyone does is we look at removing the hazard, and if you can do that, that's great. And we also know that your next step, if you can't remove the hazard, is to let someone know who can and will do something about it. And that person then is able to either remove it or manage the hazard. This happens all the time in a dental practice. For example, something that seems really insignificant. Say there's a piece of plastic, because we use barriers, that's worked its way into the hallway. You see it in the hallway and you pick it up and put it in the bin. What if it's a bigger hazard in the hallway? Perhaps a bit of carpet has lifted. You can't do anything about that, so you make sure it becomes obvious and you tell someone who can do something about it, and they call someone out and get the carpet fixed. They might tape it down before that happens. It's just really, really basic incident management. So incident reporting for accreditation involves recording the detail of what's happened. And in SmartDentist, you can record all sorts of incidents and occurrences. They can be incidents, near misses, things that could have gone wrong, feedback from patients, helping us improve, compliments, complaints, or adverse medical reactions. All of those are incidents that could be recorded in SmartDentist. So we'll go and have a look at how that happens. And the quickest way to do that is use the incident reporting form. And it's been streamlined so it's quite easy for any staff member to fill out. And the reason for doing that is accreditation requires the documentation of some of the things that we just intuitively do around the practice. The benefit for actually recording this is sometimes we miss the trends of what's happened. So we might not react to something appropriately by setting up new systems when that incident or near miss only occurs, say, every 3 or 4 months. So we've forgotten, or it might involve someone different. So incident reporting does have a role, a great role, in improving our practice. So let's have a look at the details we need. We need to report our name. So there's someone to ask about the details of what happened. And what might it be? Let's record an incident. And the incident happened last month. And the incident involved a patient, but we're not putting down their name. This are not encouraged, or you might like to put their registration number in the practice so you can follow that up. Was the incident urgent? Well, it wouldn't have happened a month ago if it's urgent. And let's have a look. Let's make it my surgery. So what's happened? A patient has tripped on the cord of my foot control. Now, for normal staff who don't have administrator login in SmartDentist, that's where the form finishes. How simple is that? For people who have administrator login, the idea is that you report the follow-up to an incident. It's no use reporting an incident and no follow-up. So I'm just going to save changes. So once that incident has been saved, it will be emailed back to the practice principal, and you'll find it in your incident register. And it will be active, so it will be marked down in red. All staff members have access to this register, but the information they see, a staff member without administration login doesn't see the detail of the report. They see the classification of the report, so they get a good idea of what's going on. So the idea is, from recording an incident, that somebody in management goes through and looks at the incident and then decides what the action is going to be. I'm going to change over the foot control. I'll call the company about doing that. And the standard would be governance standard. The category of incident would be occupational health and safety. The reoccurrence, once I've got foot control, I'm going to be rare, but the consequence could be moderate. And do I email this to the practice address or not? I probably don't need to now, and I finalise it. And you'll see as part of this form there's some great resources and links. So if you did have this, if this was a medication problem, you have the link directly to report it to TGA. So this is saved and the incident is therefore finalised, and we can use this incident to help build our risk register. So we're going to look at that in another video. SmartDentist, lots of resources for you.